specialists and cardiologists have sounded the alarm on the COVID-19 virus affecting the heart and its processes, causing many fatalities. Now, experts are saying patients who are suffering from heart diseases, including heart failure, are at higher risk of contracting COVID-19 infection. To discuss everything about how your heart gets affected when coronavirus enters your body, we have with us Dr. Thangaraj Paul Ramesh from Apollo Hospital, Chennai. Welcome to the Health Site, Dr. Thangaraj. To begin the conversation about COVID-19 and its effect on heart. So what exactly happens to the heart when the coronavirus enters the body?
This aspect has to be seen in completely two different profiles or two different times of the patient when they're infected with COVID. So the first one is as soon as the COVID enters into the lungs, it can get into the bloodstream, and it can also go directly onto the heart muscles and affect the heart. But that's relatively, what we have seen so far is that is relatively rare. What usually happens is the lungs are affected, and we have to look at the lungs and the heart as an integrated system to extract oxygen from the atmosphere and give it to the cells and take the carbon dioxide back out into the atmosphere. So for that, you require both the function of the lung and the heart to be in sync with each other. So the lung is where the gas exchange takes place, and the heart is the pump. So what happens when the coronavirus affects the lungs is because of the low oxygen that is produced because of damage to the lungs. If you look at blood vessels everywhere else in the body, when the oxygen level drops, the blood vessels become very soft, what we call vasodilatation. But in the lungs alone, they become stiff, what we call vasoconstriction. And the reason is the lungs are the organ in the body which has to accept oxygen. So when the lung senses that the oxygen levels are not very high, the vessels tighten so that the blood can flow to another part of the lung where the oxygen is high. This is an adaptive mechanism, but unfortunately, when everywhere in the body the oxygen level is low, or everywhere in the lungs the oxygen level is low, the blood vessels tighten. So because the blood vessel tightens, the blood pressure inside the lung goes up a lot. So what happens to the heart in this situation is the right side of the heart, which has to push blood through the blood vessels onto the left side of the heart, begins to start to work very hard. In people who have had pre-existing heart disease, or in people who are not adapted to this and who are physically not fit, this may cause a sudden, and this is what usually causes the cardiac arrest, is because there's low oxygen. Two things are happening. The right side of the heart has to work very high. The left side of the heart is not getting enough blood, and the heart muscles are not getting enough oxygen. All of this combines to cause a cardiac arrest. So this is acute cardiac failure in COVID. Okay, and this is this can present itself as very low heart rate bradycardia, or it can present itself as an abnormal rhythm like ventricular fibrillation or ventricular tachycardia, which can lead to a cardiac arrest.
Right. So one of the most important topic of discussion these days are the risk factors of COVID-19. So does heart disease increase a person's risk of catching COVID infection?
I think anybody can catch the infection, but could you end up with a higher mortality or a higher chance of dying? Yes. If you had additional cardiac disease, there are situations whereby, as I told you just in my previous answer, the heart has to work extra hard. Now, if there is coronary artery disease, or if there's valve disease, or if there's already some level of, say, diabetes or hypertension-induced muscle dysfunction in the heart, then it makes these patients more prone to sudden cardiac arrest, more prone to having a heart attack, yes. But one of the things that I didn't mention in my previous answer is that the coronavirus itself can affect the heart directly. It can affect it by something called myocarditis. So this has been described. So patients do get a viral myocarditis. So the virus can attack the heart, and the heart muscle function can get poor. And because there is a propensity to form a lot of clots, like you can get clots in the blood vessels of the lung, like pulmonary embolism. Similarly, you can get clots in the coronary arteries as well. And so you can have a sudden heart attack. So yes, the heart can be affected even though it is normal. It is more susceptible if it has cardiac disease, and it can be directly attacked by the virus as well.
Right. So, as you said, there can be heart complications which can trigger the COVID virus infection severity. So what are the various heart complications that can actually increase a person's chance of contracting COVID, or can increase the severity in the patient as well?
I think the susceptibility of a patient is not particularly affected by a pre-existing cardiac disease, but the outcome from the corona disease definitely has an impact if the patient is already in heart failure. Say if their disease is cardiomyopathy, which is a muscle affliction of the heart, or if you have a person who has hypertensive heart disease or diabetic heart disease. Independently, these non-communicable diseases appear to have a higher risk, or if they have obesity. This makes them, there are two problems here. There is a supply issue, so the heart is not getting good oxygenated blood, and there is a demand issue. There is a big metabolic demand of all, especially the cytokine storm and other things of all the other organs, and the heart will not be able to keep up with this demand and will further fail. So what would have been a chronic heart failure becomes an acute on chronic heart failure. And if the patient develops a lot of blood clots in the lung, then the right side of the heart can also begin to fail because of that. So multiple reasons why a person with a pre-existing heart disease may end up with severe heart failure during a COVID crisis.
To prevent the severity of the infection, the most important part is to recognize or spot the symptoms. So how do I know that the coronavirus has infected my heart, or what are the warning signs and symptoms to look out for?
The general signs are always fever and breathlessness, but this is a very characteristic sign of the COVID affecting the lungs as well. Very specifically for the heart, if your pre-existing heart failure has worsened, if you're getting chest pains, or an ECG shows ECG changes, or you're getting significantly breathless, but your X-ray appears otherwise normal, your CT scan appears otherwise normal, you can then suspect that the heart, so an echocardiogram would be the first line to diagnose whether the right side and the left side of the heart are contracting very well. So if they're not contracting very well, then you can make a diagnosis that the patient is having heart failure secondary to COVID, if they have a history of being positive for COVID and they have a fever.
Right. Considering the worsening situation in the country right now, what precautions can one take if he or she is already suffering from any of the heart diseases?
Yes, I think an online consultation, because if patients end up going to a hospital, they have a big chance of contracting COVID. So an online consultation with their existing physician or cardiologist to make sure that they're on optimal treatment for heart failure. Interestingly, it is possible that some of the drugs that are being given for heart, like aspirin and statins, may, and we are not very sure about this, may have some protective protection against the cytokine storm, but we're not sure to what extent. However, we do know that pre-existing cardiac condition is a risk factor for mortality with COVID. So you try to optimize your heart failure, make sure it's the same precautions. These patients are already vaccinated, if not get vaccinated, wear the mask, wear a double mask, stay indoors, make sure you're in a well-ventilated room, and minimize contact with patients who may potentially have COVID.
There are speculations that underlying health complications can actually increase a person's chance of death due to COVID. So are people with heart diseases too at risk of, dying because of COVID than others?
Oh, absolutely, yes. So anybody, it depends really on the cardiac disease, but by and large, all cardiac diseases imply that the heart is unable to work at optimal function. So what is the work of the heart? It really has to supply blood to all of the organs as those organs demand it. For example, if your muscle starts working out, it's going to demand more blood. In order this increased demand of the body, the heart should be able to supply. If it is not able to do it for any reason, that is what we really call as heart dysfunction or heart failure. And the coronavirus itself, either from its cytokine storm, or it's the fact that it has destroyed the lung and causing hypoxia, or the systemic sepsis that it causes, all of these put an extraordinarily high demand on the heart. And so the mortality is high when the heart is unable to keep up with this demand. Because you have to understand that the heart itself will be affected by corona as well.
Coming to another important question, as you mentioned about the myocarditis, what are the long-term implications of heart damage that can be caused by myocarditis from COVID-19?
It's not still very clear because this is an evolving pandemic, but what we can do is extrapolate from other viral myocarditis that we know in the past. So in general, viral myocarditis will resolve. Okay, so and COVID also, we expect that in the majority of patients who have their myocardium afflicted by the virus, it should settle down, and that's what usually happens in a small subset of patients, because the immune system can see a virus, and this happens with the other viruses that affect the heart. The part of the protein makeup of the virus, the immune system begins to attack it. The problem is the heart muscle itself has parts of its protein structure similar to this. So even when the original virus goes away, the immune system continues to attack the heart, and this can lead to the transition of a person from viral myocarditis to what we call cardiomyopathy. In most cases, this also will resolve or will require only medical management. But in a few cases where it leads to very aggressive heart failure, we have to think in terms of using a ventricular assist device or a transplantation.
Right. So can COVID-19 trigger heart disease? What are the various heart complications that one can expect post-recovery, and what should one do about it?
So one of the things that we do know about COVID is that it increases your ability to form clots, or normally there is a balance between the blood not clotting too much and not bleeding too much. The balance appears to be shifted slightly towards the fact that they clot more, and that's why they clot their arteries in the lung, which is a part of the reason why they get low oxygen. It's not the only reason, but it is a part of the reason why the oxygen levels go low. Similarly, it has been described that these clots can form in the coronary arteries, and if you already have kind of narrowed coronary arteries, this could lead to a heart attack. And the other thing I mentioned is the muscle itself. These are the two most common things. We have not yet come across extensive damage to the valves. Whether this will be happening in the long term, we don't know as yet. As of now, we know that myocardial infarction and myocarditis are two very clear reasons why the heart may fail. But the commonest cause for a heart to fail is actually because of the right heart struggling to work against a very high pressure that develops in the lungs of these patients.
Right. There are so many cases of post-COVID heart attacks and strokes. They are actually on rise. So how to keep our heart healthy amid recovery?
So this, the same principles as before, and I think hydration is quite important because that promotes clotting. Blood thinners. Most of patients with cardiac disease will be on aspirin, and that appears reasonable protection at the moment. If the patient has new onset symptoms, then they should consult a cardiologist. Whether they need to go on more higher blood thinners or not will be a decision that you make. Otherwise, the usual precautions like, diet, keep yourself well hydrated and isolate yourself, and vaccination. Again, vaccination appears to decrease the severity of any form of COVID, whether it is GI, heart, or lungs. And therefore, I think getting vaccinated would probably be one of the highest priorities. And we know from vaccinating people for flu that in heart failure, it reduces the mortality quite significantly in patients who are on who get vaccinated for flu. So I think the same logic can be quite easily extended. So I think the vaccination would, in my view, be one of the most important things that you can do to keep your heart healthy.
We'll come to the vaccination part, but before that, you just said about diet. So what diet one should follow, heart healthy diet post-recovery to keep the heart healthy? Any particular diet that one should actually follow?
Currently, the low-calorie, low-carb advocacy for patients with heart disease has some data to support it. So there has been regression or certainly a reduction in patients with coronary disease. So I think it might not be wrong to follow a similar thing, so that essentially, and the fact that we do know that people with a high BMI or are obese have a higher mortality from COVID. So putting all this together, I think a low-calorie, low-carb diet combined with an exercise should logically form a part of protection against heart disease of any kind. And I would presume that it applies to COVID as well.
Right. There are several exercises to detox the lungs, which also gets affected, which is the organ which gets affected by the COVID infection first. So are there any for heart too, any particular exercises or something that patients who has just recovered from COVID should be doing?
I think it is very useful to think of the heart and lung as an integrated organ system. So whatever is true for the lung is true for the heart as well. Because if you look at a chronic lung disease or chronic heart disease, any long-term heart disease will affect the lungs, and any long-term lung disease will affect the hearts. So the same things that you apply for the heart, that is improve oxygenation by aerobic exercise or yoga is actually very good, deep breathing exercises, all of that, whatever is useful for the lung will be useful for the heart as well.
Right. The third wave is expected to hit India, and mostly it will affect the children. So can we expect the heart problems in them also, and what can we do for that?
This will be in the realm of speculation, but what we have seen so far in the children affected, it appears again to affect mainly the lung. Some of them have quite significant GI or liver problems. But yes, I think it is very reasonable to expect that children may suffer from viral myocarditis because even otherwise, that is usually a disease of children or of the younger age group when non-COVID viruses do attack the heart. So it is possible, but of course we are speculating. Only if the wave comes and if it does affect children as people do anticipate, we have to see whether that happens.
Right. So, just for precautionary measures, what are the signs and symptoms that we can expect in kids and children? If they get affected by the virus and their heart is also infected.
Yes. So high fevers that are unrelenting, followed with breathlessness, cough. So it's exactly what I told you about the heart and lung being an integrated system. You cannot really separate out the symptoms in both. If your heart is not working, fluid will dam up in the lungs and it will cause cough and breathlessness. If the lung is directly affected by COVID, it will cause breathlessness and fluid buildup in the lungs as well. So the kind of symptomatology will be exactly the same. But if the patient has, say, for example, diarrhea, which is unrelenting, anything where within 24 hours, the patient, after taking the routine paracetamol, is not settling, and also if the patient is being monitored with saturations are dropping with a sensation of increasing breathlessness, then they definitely have to be evaluated in an emergency room.
So one last question that I want to ask you is, there are rumors around that people who have heart-related complications should not take the vaccine, or people who are already on medications should not directly go for the vaccinations right now. Is it true, or can anyone take the jab?
The problem is one of the vaccines appeared to cause a higher than expected clotting rate, or the patients ended up with clots in the brain and clots in the lung. So this led to widespread fear. But if you look at it in statistical terms, the number of people who are protected by the vaccine, as far as we know now, is much higher than those who have suffered from it. Myself had a stent many years ago, and I'm on aspirin, and I took both doses of the vaccine. So at a personal level, I've taken it. I think the protection or the benefit from the vaccine far outweighs any potential risk for patients with heart disease. So my thing would be, no, take it.
So thank you so much for giving your time to us and for sharing the valuable informations with our viewers. I think these will help them to understand how vaccination is so much important right now and get rid of, all the speculations that are going on.